We're here this morning to share those thoughts with you and to ask your help in disseminating this information clearly, consistently, and in as concise a manner as is practical in such a situation.
So I am Nita Ludwig, Administrator of Rock Island County Health Department, and I would like to share the idea of flattening the curve with you today. Because this is a new virus that no one has any immunity to, we do expect cases in the Quad Cities. We could possibly see a large number of cases. Flattening the curve refers to the way in which pandemics affect the healthcare system. It's a method of slowing down quickly rising case counts. So as you can see by the slide that's on the screen, that is the typical curve that happens with a pandemic. If you can see the sudden spike, that's when a lot of people get sick all at once and all go to the doctors, clinics, and hospital systems. And these systems also become overwhelmed with numbers of patients and they could run low on supplies needed to care for the people. After all at once, if we can stretch or flatten out the time period, doctors and hospitals can maintain their supplies better to care for those who really need them, and then they will be more able to care for the large numbers of patients in a more manageable way. The overall result would be fewer people infected and fewer deaths, as noted by Dr. Anthony Fauci with the National Institute of Allergy and Infectious Diseases. This has been shown to work and was a method used in China, after which the cases have declined. Recommendations on how to go about flattening that curve will now be reviewed by Mr. Ed Rivers from the Scott County Health Department.
There are no known cases of COVID-19 in the Quad Cities at this time. However, it's likely that there will be. So the COVID-19 Coalition has a set of recommendations to help flatten the curve and prevent overwhelming our medical resources. Our first recommendation is consider avoiding social gatherings or community events where you cannot maintain a 6-foot distance between yourself and others. Organizations are encouraged to postpone social gatherings or community events of 250 people or more. If you're an organizer of such an event and you have not taken this step, we strongly urge you to do so now. If you have COVID symptoms, fever, cough, shortness of breath, please call ahead to your medical provider or walk-in clinic. Please do not just show up to your medical provider, walk-in clinic, or emergency room. They'll want to prepare for your arrival to protect others in the facility. Stay home if you're sick. Please don't go out and expose others. We're encouraging local employers to implement flexible sick leave policies to accommodate you if you are sick. If you're considering travel, monitor the spread of COVID-19 at your destination and along your route. If COVID-19 is spreading at your destination, you may be at higher risk of exposure if you travel there. We also have a set of recommendations for individuals to help you protect yourself against this disease. You've probably heard them before, but we cannot emphasize them often enough. Clean your hands often. Wash your hands. I'll say that again. Wash your hands. It's your first line of defense against this disease. Avoid close contact with other individuals. Stay home if you're sick. Cover your coughs and sneezes. Clean and disinfect. Think about doorknobs, light switches, tabletops, chair arms, those things in your environment that you routinely touch and others perhaps touch. Make sure you have sufficient medical supplies if you require them. An additional note, older adults and those with chronic diseases are particularly susceptible to this disease, and this is especially important if you're planning travel. Take that into account if you're planning on traveling either within the United States or elsewhere. We thank you for listening to our recommendations. We hope you will implement them, and we hope that we'll be successful in flattening the curve and making sure our medical professionals have sufficient resources to handle their response. Thank you.
Good morning. My name is Lisa Caffrey. I'm Infection Prevention Coordinator at Genesis Health System. And I just want to share with you a little bit about what our health system is doing to prepare for this. We have been preparing for several weeks now. We are closely monitoring the situation and following the CDC guidelines for hospitals, as well as the guidance from our public health partners. And the things that you can do to help us be ready is, number one, follow our recommendations on visitor restrictions. It is really important that we minimize the number of people in our facilities. And we have, our signs are posted, and we would really appreciate it if you followed those. Secondly, as was mentioned earlier, call before you're coming in to see somebody if you think you have COVID-19. We want to be able to protect everybody, including our healthcare workers, and have the appropriate masks or whatever are needed available. If you are tested at our facility or any other facility and you are told to stay home, that means you stay home until that test result is back. You cannot go to the mall, go to church, whatever it is you want to do, you need to stay home until you know the result of your test. That way we can protect the community and others. We are working diligently with our staff to be sure they're comfortable with the isolation precautions that are recommended and the equipment needed for caring for the patient with COVID-19. And we just really, is so important that you listen to what your healthcare provider is telling you, what our public health departments are telling you, so that you can protect yourself and be prepared for whatever is to come. Thank you.
As you know, a lot of places have started nationally canceling different events, such as the NBA season, the NCAA tournament, things like that. And we knew that in our area that was going to be affecting us as well. And we have a great group of people. We formed this Quad City COVID Coalition, and we decided it was time to meet with all these various partners. Now we have the businesses and the elected officials joining in this effort. And so it was time to start making some recommendations, getting calls and questions, and we just thought the timing was right to give the public our best recommendations for those.
What's the availability of local testing kits?
So the testing is done, Angel can help me with this, we can test people here, but the specimens have to be sent either to our state hygienic labs, either in Iowa or Illinois, depending upon your residence. And if we're using a commercial lab, they will be sent to another lab location, perhaps in North Carolina. So we can test people, we can get your sample, it gets sent out then to another lab, and then we wait for those results to return.
And how long are those results taking?
It depends on where it goes and the timing of everything. It takes about 24, 48 hours, depending upon where it goes, maybe a little bit longer. Keep in mind, this is happening across the country, so these labs they're working really hard to get those test results turned around, so it could be a little longer than that.
Can anybody have been, if people have been tested, sorry?
I'm just not up to speed on the number that have been reported to us.
And what recommendations are the health department giving to schools?
We're consulting with schools. We're having a joint meeting with the 4 superintendents this afternoon to develop strategies for them. Their prerogatives are different, say, from universities. If you cancel schools through K-12, you're also affecting the workplace, pulling people out of the workforce. So we'll be consulting with them this afternoon. Fortunately, spring break is next week for many of them, so it's not as pressing an issue. We have some time to plan, and we'll be working on strategies with them.
When will the hospitals disclose the number of tests that have been completed and when kits will be available?
Well, kits are available. Yes, go ahead. Kits are available. We're currently able to test.
And it is difficult, especially when we both have facilities on both sides of the river, so.
Can you speak for your facility alone when you'll disclose how many tests have been given?
Well, I'm not certain if it's necessary to report exactly how many tests we have run. Obviously, when we have positive tests in the area, that's when the departments of public health will speak out about those results.
Well, given that you have to qualify, so to speak, to be tested, that would seem like an important number, would it not?
And it's important to know who may be at risk, and that's why we have screening in place to identify those patients and test. But there's a number of other reasons that patients could be ill right now. We have a lot of influenza circulating in the community, strep, other respiratory illnesses that are causing those infections also right now.
Right, but I thought you said if you tested negative for influenza and or strep, you then would qualify to be tested for COVID-19.
That's just one of the criteria. There's other criteria as well. So it's a
Right,
very
travel.
difficult algorithm on both sides of the river for both states. So it's not as black and white and cut
Maybe
and
you
dry.
could tell us what are the reporting requirements?
So we don't
Even
have,
for influenza A, you have to report positive tests, right?
no,
No?
influenza, in Iowa, I'll speak for Iowa because Illinois is a little bit different. Influenza is not a reportable illness in Iowa. So
But COVID-19 is.
COVID-19 is, and our lab partners will be doing some of that reporting. So the lab is keeping track of this stuff, and they'll be reporting it to our public health department.
The positive
The
results are
positive
reported.
results, yes, positives are reported.
And then influenza is reportable, but it's in Illinois under certain
it's different.
conditions, ICU admissions, things like that.
I heard
Thank you.
Trinity, I believe, say you're not going to disclose. How about Genesis? Are you going to disclose the amount of testing you're doing?
I don't know that at this time we'll disclose that information. I can ask when I get back up there, but we don't normally do that. We would probably work with our
Not much
public
normal
health.
about this, is there?
Well, but we're partnering with our public health. The message is that, as Ed, I think, said, that, it's likely that there's probably some in this community. We just don't know yet how many cases are out there. When it happens, public health will tell you when there's a positive case. But what we were trying to get to is that. That's our
Help
point
me make the
today.
connection between public health, because public health just told us they don't know and don't know how to get it.
What do you mean?
That Dr. or Mr. Rivers just said he
Yeah,
doesn't have the
They'll be
information.
aware
I'm
of the
not
They
sure.
know about the
positive. We'll let them
positive
speak to what they will
results,
do for the positive results.
The Iowa Department of Public Health has a website that you can go to see the number of tests performed by the state hygienic lab, the number that are positive, and the number that are negative. What I said was that personally I was not up to speed this morning on the number of tests performed in Scott County from that number at the state hygienic lab, and I don't want you to speak.
Gotcha. So will the public here ever know how many tests have been conducted here in this county?
I'll have to get back with you on that question.
Could I just add a little bit there? So the Illinois website, Illinois Department of Public Health, does have total numbers tested in Illinois. It's not broken down to the local levels at this time. We do also expect in the coming days and weeks that there will be more supplies of test kits to these labs, both the commercial labs and the state labs, which we have 3 in Illinois, Chicago, Springfield, and Carbondale. So we do expect that to ramp up. There's going to be lots of people that will probably be tested in the near future. So those numbers are going to hopefully rapidly become increasing, and the system will be much more robust than it is today. I think you've heard that all across the country, that there's not as many test kits as we would like for those laboratories, but we keep getting reassured by CDC and other officials that those test kits are coming. I do know there are several private companies that are also working on rapid tests, so that might be something that comes down the future too. This is just a rapidly evolving situation, and we don't know exactly how it's going to pan out at this time.
What are the hospital systems doing now to prepare for a situation where we would have a lot of people sick? Are we deferring surgeries or other things now, or?
We do. Both of us have surge plans should we have an influx of potentially infectious patients or patients with COVID-19. And so a lot of things we would review. And it would depend on the level of the situation we're at in our community. As it increases, we would maybe potentially put additional things into place, but anything like that could be reviewed if necessary.
But specifically, what steps are you taking now to prepare?
Well, we have pulled out our surge plans and are educating on those, reviewing those, determining at what point we may need to enact some of those mitigation efforts.
What are those mitigation efforts look like?
So obviously you mentioned one as a potential, and not saying that we would do that anytime soon, but it's something to think about. Would we need to potentially delay elective procedures? That way we have more bed availability. So that's definitely one potential option.
But right now it's business as usual?
It's business as
Yes.
usual.
Yep.
Yeah. We're monitoring the situation carefully. We have plans in place that if we have to go to that extreme, we have staffing plans in place that we can tap into if we need to go there. So we have all of our plans. We're just, waiting to see how the situation unfolds and what we need to do.
How long will it take until we know whether we flatten the curve?
I don't know. I think that really is an unknown at this time about how long to flatten. The idea being, even if it's the same number of people that will be infected during the course of this whole pandemic, if you can stretch it out and not send everybody to these healthcare systems at the same time, that it's more manageable. They'll be able to resupply their stocks of what they need at the hospitals and healthcare systems.
That dotted line, how many very sick people hospitals can treat, what's that number look like?
Can you repeat that?
The dotted line on the graph, how many very sick people hospitals can treat, what does that number look like?
So we have projections all lined up out there that we're working on. And that's how we're working through our surge plan, taking models using our worst flu season, and then thinking about how much worse this season could be based on what we're seeing in Seattle and other parts of the country. So,
what are those models telling you?
We have capacity. We have some capacity, but we will hit our limit at some point. We're still trying to work through that to see exactly what that number will be, but we are working towards that.
How many hospital beds are there in the Quad Cities?
I don't know that answer.
Not off the top of my head. It'll take a little time.
If you know
to
your
roll that out.
facilities, we can do the math.
So, for the Davenport campus, I don't want to give you wrong numbers. Do you know?
You're licensed for a certain number of
Well,
beds in
but
each
you
facility,
remember,
is
we
that right?
have hospitals in multiple cities. So our Davenport campus is licensed for 502 beds. I can't answer for Silvis. Our critical access hospitals are a little bit smaller.
Those are probably on the websites, aren't they?
Yeah.
Under the licensure information.
I know Davenport's 502. Silvis is considerably less than that. And our critical access hospitals are even less than
And
that.
there's one private hospital here in the Quad Cities too.
Select, yeah. I can't speak for them at all.
No.
So there are 45 or 50 of us here in pretty close quarters. Is this an endorsement? Is this an okay size?
It's under 250.
Right now, it's under 250.
Yeah. So the recommendation is 250. We'd certainly prefer everybody to have a little space between each other and to practice good hygiene, use your sanitizer, wash your hands. I'll say that again. So.
All right, going to wrap up the official part of the press conference.
Paul, can you take one more?
Thank you very much. This is going to be it. Want to recognize that this coalition will continue to meet and will provide updates on a regular basis as more information comes available. So thank you very much.
How will those updates be distributed to us?
There will be, that's not my area of expertise. Brooke?
We're meeting after this to determine that, and so we'll be able to share that with you.
As this progresses, can we have these briefings again?
I believe that as needed, yes, we will. Thank you.